Who dictates the planning of a family? Is it the man, woman, or both genders? This week, we traversed two counties, Kericho and Nandi, to analyze the data provided by PMA and to analyze how this data impacts the sexual reproductive health in these two counties. The green lush environment welcomes us to Nandi County in the North Rift region of Kenya. As per the 2019 national census, the population is estimated to be 885,771 with a population density of 310 people per kilometer squared. The county has a rich child population where 0 to 14-year-olds constitute 45% of the total population. Fertility rates among women are high, the highest percentage of a household size being 4 to 6 members. Community health volunteers play a key role in household surveys. Now Michemeli is one of them.
Katika community usipokuwa na watu hautaweza kupata data, na kitu ya kwanza yenye inatakikana ufanye ukuwe na urafiki nao, jinsi ndio watakuwa na urahisi, kutakuwa na urahisi wa kukujibu maswali ambayo unawauliza.
We meet Nicholas Kibet, a youth in Nandi County and a family planning champion. Traditionally, Kalenjin communities are known to love big families, a thought that Nicholas thinks cannot work in this era.
Mimi ninatoka kwa jamii ambayo tumekuwa na changamoto sana, especially wakati ikifika maneno ya masomo ama chakula ama hata ulinzi ama jinsi wazazi wanachunga watoto wao. Nikaona ni vyema sana wakati vijana wetu wanazidi kuoana ama wanapanga kuoa, ni vizuri pia wanajua zaidi kuhusu family planning. Na nikasema itakuwa ni vizuri nikiambia vijana, kwa sababu mimi ni mmoja wao ambao nimeoa na nimejua uzuri ya kupanga uzazi.
He is a young father and says he often discusses with his wife matters of contraceptive use.
Na mimi kwanza nimepanga uzazi kuanzia mbili. Ya kwanza nimetumia natural method ambayo ukiwa na mtoto unajua kwamba huwezi fatanisha watoto. Nilipata mtoto wangu wakati walikuwa na miaka 4, ndio nikaongeza mtoto mwingine.
Betty Mayo and Nashon Mayo have been married for the last 7 years. We meet them at their family home in Nandi.
Kwa sahi maisha vile iko, ninaona maisha ya familia kuwa kubwa inakuwa ngumu kwa ajili ya ukitafuta, ni ngumu kwa ajili ukikuwa na watoto like kama watoto 5, kutafuta mahitaji yao ni ngumu sana. Si kama mtu mwenye ako na mtoto mmoja ama watoto 2 mwenye anaweza tafuta na apate kwa haraka. So ukiwa na watoto wengi maisha inakuwa ngumu.
Nashon shares her sentiments.
Family planning in my view imekuja kutusaidia. Ingawaje bado kama kwa society yetu sasa kama Kalenjin ni ngumu kwa watu wengine kuchukulia, kwa maana yake nataka ile education more ndio waelewe. Maana yake kama kitambo unajua Kalenjin wa farmers na cattle wrestling, so kulikuwa na mashamba kubwa watu walikuwa na pata watoto wengi, lakini sasa hizi hii mashamba bado haiko. Hiyo kuona hiyo ng'ombe imekuwa mmoja wa poma 2, so inabidi tena utumie family planning ndio mude watoto watakuwa nao na itawatosha na process ni bado isiko.
According to Betty, she initiated the family planning conversation. Currently, their firstborn child is 6 years old, while the secondborn is 3 months old.
Kwa ajili ukiona hapo nyuma, ukifuata sana unaona watoto wengi walizaliwa wengi, lakini hawakusoma. Wengi kwa society yao ni wengi walikuja wakapotea kwa ajili wengi walika beleni kwa ajili wako kwenda shule. So unajua mtu akikaa nyumbani bila kazi, alafu wanafulana pia wasipoenda shule wanapatana kijijini, so wanaoleka mapema na wajipangi. So wakifika tena kule na kwa ajili kuna shida, unajua watu wakikaa nyumbani bila kazi wanakuwa idle, so watoto wengi wanazaliwa kwa haraka sana. Unlike kama wangetumia family planning, wangekuwa wanajipanga, wanajua kwa muda tunatumia hii, ikifika mahali fulani tunapata mtoto mwingine.
Kipkemboi Meto is a community elder. He says modern family planning methods has interfered with culture.
So currently in Nandi we are seeing a lot of challenges, and I personally within our community, being an elder and being a staunch Catholic, to not really accept the use of contraceptives or other means of new means of planning our families. We have the natural way. We know that we have, and all over our women really know that there's another God-given way of controlling how you conceive and at what time, given that you know your monthly sequence and how your body reacts.
He understands the need of spacing children, but says he can only do it naturally.
That's something which was there in our culture. We used to have children at the right time when we had enough food. And in the Nandi culture, when a woman had a child, you could not have accept your wife to have a child during the time when there's no food. So the setup of the family used to save for that woman when she had a child.
A survey conducted in 2021 by Performance Monitoring for Action Kenya PMA and the International Center for Reproductive Health shows that there has been a decline in the modern contraceptive prevalence rate in Nandi County over the past year. How are households selected and how does she go about collecting the data?
Okay, vile tunafanya, as before we start data collection, tunaendanga training. After training, the first thing to do tukifika field, tunafanya what we call mapping and listing. Mapping and listing is identifying penye munaweza fanya hiyo kazi. So after identify the area, munafanya listing. Listing no kuandika majina ya nyumba kutoka nyumba. So approximately the maximum number ni 300 households. Tukiwa na hiyo listing form yenye tumeandika majina, they randomly select households, 42 households yenye tunafanya hiyo survey. So we don't go to each and every household for the survey. They randomly select 42 households, and those are the households we follow for the years we are doing the survey.
Data collected is then forwarded to the Ministry of Health, which helps in compiling national data and planning of resources. PMA project has employed a unique design for the last 3 years, where it obtains key information from the same women and households over time. However, not all respondents consent to be included in annual follow-ups.
PMA basically is a global project, and it is a measurement project responding to the current need for data to inform decision making. So we are collecting data globally from 9 countries and countries from Africa and Asia. And the data or the project is basically designed to collect data that informs policy and programs. And in the country, the project is running in 11 counties, and we are working very closely with partners and the Ministry of Health to make sure that this data is utilized after correction.
Results from the national survey showed that 16% of adolescents reported that they had discussed family planning with a healthcare provider or community health worker in the past year. In Nandi County, about 11% of adolescents are using modern contraceptive methods. Nandi County District Health Information Software DHIS data shows that in 2021, at least 214 children between the age of 10 to 14 years were pregnant at first NC visit, while those between 15 and 19 years in total were 3,290.
What is was projected by the survey seems to be mirroring what we have in the DHIS. The data that we routinely submit to the national level. So, number one, the aspect of our children getting pregnant at a younger age is a reality. As to why Nandi seems to be at the top of it or in the forefront in ensuring that our children are getting pregnant. it is something that we need to analyze across all the spheres of life around Nandi. Our health workers, yes, are there, but what do, I mean, for example, the policy says that teenagers are not supposed to be provided with family planning commodities. So we need to have a stakeholders meeting and really dissect those findings and bring in everyone who can play a role, from the church, the education sector, the civil society organizations, anyone who is out there who is able to speak to our teenagers about, I mean, not getting pregnant, and anyone who is able to protect our teenagers. You realize if you go deeper, you will probably discover that these are children who probably come from the lower segment of our society. Something must be done about that. Nandi, on average, may not be a poor, so to speak, county, but then we know that it is the children of those who are down there that are getting pregnant. So why are they so exposed? Is it education they are lacking? Is it ignorance ranging from the parents' side and all that? We look at that, bring in the stakeholders and have a discussion.
Although the offering of contraceptives to minors has been a key discussion in Kenya, with the Ministry of Health maintaining that it remains illegal to offer contraceptives to anyone below 18 years of age, they still access the commodity.
We encourage our women generally to go for longer acting methods of family planning. One of them is insertion of IUCD, or intrauterine contraceptive devices. Insertion and removal is a skill that is trained for after school. It is not something that is covered in their colleges, in KMTC and in the universities. You have to be trained outside of your school. So generally we've had partners in the past that have helped us train our health workers in our bigger facilities. Like for example, the 40% you're talking about, these are newly employed nurses and clinical officers who work in peripheral health facilities. So once in some time, at least we get a partner that helps bring them to the bigger facilities for purposes of mentorship and training. And again, we do budget as a county government. We normally provide for a small fund in our budget to cover for training, and that is one of them, yes.
Despite the progress made in providing modern contraceptives, 41% of pregnancies in Nandi County were unintended. A third of the women reported that they would have wanted to delay their most recent birth or current pregnancy.
Today was a dissemination of this data to the county health management team. That is the team that is responsible for all aspects of health service provision in our county. So we shall go back to the office again, sit with the same team, and look at that data, analyze each and every of the finding that was projected here, look at, identify the factors that probably I am able to explain, look at the weak areas which probably requires interventions. If it requires training, we of course draw a plan of ensuring that our health care providers are trained. To where we require resources, it will help us again in putting in our budgets and presenting to the county assembly to ask for more resources. Things like even just carrying out support supervision in our health facilities, or even obtaining the stocks of non-pharmaceuticals in terms of gloves, in terms of the drugs that we require for that, yes.
Different challenges have affected the distribution and availability of modern family planning methods at public facilities, from not offering intrauterine devices, IUDs, stockouts for implants, lack of trained providers, and instruments and supplies needed for insertion or removal.
In terms of the findings that were projected over there, you realize reasons that were given out by a number of them is that they fear side effects. Two, they think they will not get pregnant because the husband is away, that they're having infrequent sex. You know, those are things that are assumed, and these are not the very difficult things to be handled by CHVs. If we can utilize our CHVs, it will multiply whatever the health workers have been able to do in terms of delivering the key health messages, in terms of even dispelling the myths and misconceptions surrounding these products, and and even where possible, accompanying some of them and telling them where to find these products. Because I must mention again that in the data that was projected by PMA, you realize that, for example, a huge proportion of our teenagers are obtaining this in the chemists out there, where they are not able to get any message surrounding the same products. So if you can have the CHVs going out there and interact them freely with the teenagers, the better, because these teenagers can get the right message surrounding the utilization of the products.
Still in Rift Valley, modern contraceptive use in Kiricho has increased from 38% in 2014 to 54% in 2021, with more than half of women of reproductive age currently using. In Chamungusu village, Ainamoi constituency, we are welcomed to the homestead of Nicholas Kibet, a father of 3. He tells me that family planning has its advantages.
Okay, family planning, according to me, is good. It has its advantages, and maybe I can state in 3 categories. One, for a father like me, when we use family planning with my wife, it helps us in economy, like it will give us time between the children. They will get what they want because we will not be strained as much. Giving a period of 3 to 5 years, it's enough for us to jipange. So I will encourage family planning for the economy. Now, for the mother, she will have time to maybe show love for the children, and for the children also, they will have that, the concentration will be on them, as in they will get everything they need, not like when they are many. When they are few and correctly spaced, they will have that love from the mother, and the little we get, like me, I'm a farmer, the little we get from farming, it will be enough for them. Not like when we are many. We have, when we are many, we have so many stomachs to feed.
He says in comparison to Western countries, small families are embraced, yet they are the most developed with better resources, unlike African families.
Our fathers never used family planning because, one, the resources were too many. You could find, like my grandfather, the late Zakaria, had a very big farm, had a lot of animals here and there. He was doing business, and business that time was booming, not like now. So he could end up maybe even marrying 3 wives and getting 7 children per wife. That is 21 children. So with this population which is increasing, and the lands and this resource is becoming smaller, I don't think we will apply. Okay, the Europeans, maybe they are far much ahead from us, but it's not like we are copying them. The situations are forcing us. This thing is becoming smaller. Now look at this, and having 7 people here, that one will be more than what we have.
For him, his wife proposed the use of contraceptives and he did not object to it. Dr. Betty Langat, the County Director for Health in Kiricho, says that over the years a lot of changes have occurred in the sexual health and reproductive services being offered in the county.
It was a very interesting survey because it shows us that within Kericho County, the modern contraceptive use is at 68%. That means the women within Kericho County are able to access the family planning methods, the modern family planning methods. However, most of the clients, majority of the clients, go for the injectable method, followed by the implants, vis-a-vis the other methods. And as a county, we are encouraging that most women, for their use, we are encouraging them to use long-term methods, because most women would really want to have family planning for spacing, or some of them women would like to have, or maybe they are not intending to have more children.
Increase in family planning use over the past 3 years has been attributed to the increased uptake of modern short-acting methods. However, unintended pregnancies were still recorded at 48%.
Some of the issues that came up is that we have missed opportunities in terms of some of the women are not given counseling within the facility level. And when they are not given counseling, they are not able to choose. And we have a few of our women who are not using any other method because they missed the opportunity. They were able to come to the facility, but because of lack of counseling, they were not able to choose a method, or they were able to switch into a method that is good for them. And as a department of health services, Kericho County, we would like to use the information in terms of planning for training for staff, in terms of planning for procurement of equipment, so that the people at the facility are able to use that information. Some of the facilities were not able to give service, especially the dispensaries. Now that we are talking of universal health coverage, we want most of our clients to be able to get their services closer to them at the rural areas. And in that case, that means we need to train more of our staff. We need to provide equipment in those facilities.
With both counties having their county data, which provides similar frames as presented by the DHIS, the data is key moving forward.
As a department, we do not have a reproductive health policy or family planning policy, and this information would really help us when we are developing our policies. And this will help also the communities in terms of getting services within the facilities of choice. We also want to use this information even to look at, to discuss with the private sector, including the chemists, on the methods that we need to give the clients, so that we are giving the best to our clients. We have the issues of adolescent pregnancies. Kericho has in the past been even in the news that it has the highest number of adolescent pregnancies. Yes, from the survey we've realized that we have very few of our girls between the age of 15 to 19 who are not using family planning. However, we are still waiting for guidelines and waiting for the ministry to give us policies on use of family planning for the adolescent group. But we also want to encourage the communities to be able to talk to the girls and encourage the girls not to have sex before the rightful age. Because from the report that we have, the girls from the rural community have sex at the age of 17.
Naomi Chimeli says that when collecting this kind of data from respondents, different challenges arise. At times, women are afraid of their husbands and partners finding out their status.
So, maybe just to bring it to the recent years, in the last 2 years, we have seen counties using the data to inform development of their costed implementation plans. And we have also seen them using the data to plan when they are doing their work plan. They use the data to set their targets, and they have also used the data to identify the gaps they have in family planning programs, just to make sure that whatever interventions they are designing, then they are responding to the current need as provided by the data.
With the majority of the women involving men in their family planning decisions, there are key lessons on the role of men.
Changamoto yenye inapatikana ni wakati wa kuinterview msichana from 15 to 17 years who is in a teen, inampidi umpate consent from the parent, then ye mwenyewe msichana ata assent. So maybe msasi atasema I'll be there when you will be asking my child these questions. Since maswali ya mtu 18 to 19 haina tofauti mbali na hii ya 15 to 17. So msasi kama mama anaweza sema you might be introducing my child to new things. So anahitaji kwa hapo, so itabidi umuongeleshe mama, umwambie these things are confidential, because mama akiwa hapo msichana hawezi akakwambia siri zake kama hiyo swali ya do you have a boyfriend. So itakuwa ngumu kwa msichana kukujibu.
By design, the selection of the counties was supposed to ensure that we generate a national estimate and also provide county estimates in the areas we are implementing. So the design was or the selection of the counties was done by Kenya National Bureau of Statistics, and they ensured that whatever sample we will be able to use and whatever counties we will be able to correct the data, then they can be able to represent the whole country. So, and that is how the design was done, and the data has been able to generate a national and a county estimate.
From the data that we have seen, most of the women said that they discuss with their partner, and of course the partner is a man, on issues of family planning. In this case, we need to encourage the men to accompany even their women as they are going to family planning. As a community, we normally have the women going in for family planning or ANC minus the men. But we need to encourage the men so that they know even the different contraceptives. They need to be part of the discussion on when to begin and which contraceptive they need to use, and when do they want to have the baby as a family or as partners in a relationship. So we would want to share this with the men, both at the community level, at the facility level, to see how best can we bring in men into family planning. When we look at the methods that we have, it targets mostly the women. The other methods, which is male condom and vasectomy, are the only methods that normally go to the men. But we want the men to participate in the decision making when the wife or the girlfriend or the woman in their life is making a decision on family planning.
To be able to make sure that this data can be utilized to inform the programs and also to inform the communities, then they need to bring other key partners who are doing this implementation to ensure that they can run with the data after we have disseminated to them, and they can use it to improve the livelihoods of the communities they are serving.
The uptick of family planning has increased in the country among women, especially in Nandi and Kericho County in the last 2 years. But there is still an unmet need for family planning among women and the information necessary for this particular women. This is a clarion call for the different stakeholders involved, right from pharmaceuticals, national government, county government, and even the community health volunteers. Saada Hassan.